Hi there, my name is Brady MacKenzie. Today I'm going to be sharing with you my summer research project titled West Nile Virus Seroprevalence in the United States and Canada, a systematic review and meta-analysis. West Nile virus is the most widespread mosquito-borne virus in Canada and the US and can cause fatal disease. With climate change expanding mosquito habitats, the burden of mosquito-borne diseases like West Nile virus is expected to rise. However, it's difficult to know how many people have been infected because many infections are asymptomatic and go undetected by clinical surveillance. This is where seroprevalence studies are helpful as they measure antibodies in the blood, which show how many people have ever been exposed to West Nile virus, even if they didn't show symptoms while they were infected. The goals of my research this summer were to first appraise the quality and completeness of available West Nile virus seroprevalence data in Canada and the US, as well as to estimate and compare overall seroprevalence across different population groups, and lastly, to apply statistical and visualization tools to make sense of the data and identify key patterns. This project had four major steps, the first being a systematic literature search that was conducted to identify studies reporting West Nile virus antibody testing results. This was part of a larger systematic review for the ArboTracker dashboard. Then data were extracted and critically appraised by two reviewers. Basic descriptive analyses were conducted using R. And lastly, a random effects meta-analysis was performed in R to estimate pooled seroprevalence. In total, 29 studies were included in this meta-analysis. The highest seroprevalence was found among PCR positive or clinically suspected cases at about 16.1%, showing strong clinical capture of symptomatic infections. The lowest seroprevalence was among blood donors at about 0.26%, suggesting limited community level transmission. 65.5% of the studies were classified as having either a high or moderate risk of bias. As well, most studies tested for IgM antibodies, which indicates an overall focus on identifying recent infections, as IgM is the first antibody produced by the immune system in response to a new pathogen. These findings were then visualized through box plots and a forest plot to show variability and confidence intervals across populations and regions. Here, figure 1 shows how seroprevalence varied across different population groups. PCR positive or clinically suspected cases are shown at the top with the highest seroprevalence, while blood donors and community samples have the lowest levels. The red dots represent individual study estimates. Figure 2 compares average seroprevalence by country. Canada shows a wider range of estimates, reflecting limited and uneven data availability, while the US shows a narrower and more stable estimate due to the larger number of studies available. Figure 3, the forest plot, displays individual study estimates and the pooled averages. There's wide confidence intervals for many sampling frames. This reflects high heterogeneity, meaning results differed substantially across studies, likely due to variations in populations, testing methods, and time periods in which the studies were conducted. Overall, these results suggest that West Nile virus transmission remains low in the general population, with most infections likely being identified through clinical surveillance. High seroprevalence found among suspected cases indicates effective capture of symptomatic infections. However, the high heterogeneity and risk of bias limit the generalizability of these results, showing the need for standardized study designs and improved reporting. The lack of consistent data, especially in Canada, limits the ability to assess long-term trends in West Nile virus circulation and highlights an important surveillance gap. Based on these findings, some future directions to follow are to first establish standardized serosurveillance systems to consistently and accurately track West Nile virus exposure, as well as expand evidence synthesis to include newer and more geographically diverse studies to increase the generalizability of these results. Lastly, to integrate these findings into the ArboTracker dashboard, which is an interactive living systematic review. Pictured here is the ArboTracker dashboard, where arbovirus seroprevalence data are publicly available. Users are able to filter by pathogen, sample frame, as well as region of interest to explore and compare seroprevalence estimates for various arboviruses. Here are the references I used in the making of this presentation. I would like to thank my supervisor, Dr. Tyler Williamson, as well as Mairead Whalen, Harriet Ware, Emily Taves, and the Serotracker and Center for Health Informatics teams for their support this summer. Thank you for listening.